Punit Dhillon is our next guest. He's the CEO and chair of Skye Bioscience, and I see him here. There he is. Sir, good morning. How are we doing today?
Hey, good morning, Spencer. Nice to be on the show again. Thanks.
Yes, nice. It's great to have you back, guys. I see Punit's slides there. Let's get them up on the screen. We're good to go. The floor is yours, sir.
Awesome. Well, pleasure being on the Benzinga show, and thanks again for inviting us. It's incredible in terms of the Benzinga platform, and we love getting the story out. Skye Bioscience is a pharmaceutical cannabinoid company. Before I begin, I'm going to just remind everyone to please review the risk factors associated with some of the forward-looking statements I'm going to be making. Those can be found in our SEC documents. Let me begin by just saying that Skye's focused on a very bold mission here. We believe that cannabinoid-based pharmaceuticals are going to disrupt the therapeutic unmet needs in a whole range of different applications in the pharmaceutical market. We've been, hey, Spencer, you're still there, right? I can't see you. I'm assuming that I'm online. Okay, so basically the basis of this is that that the cannabinoid derivatives can really be a transformative new class of therapeutics. They have a potential for some active biological activity. They're able to tackle very complex therapeutic pathways and tap into a relatively new, newly understood system called the endocannabinoid system, and they're able to modulate a whole different type of responses that are shown to play a very significant role in overall health. So we definitely believe that cannabinoid pharmaceuticals are a wonderful platform. Their ability to go from this idea of a synthesis of novel molecules into formulation and then efficacy is quite a intriguing opportunity without having to deal with the plant and having the complexity related to large scale harvesting or anything like that. So we're using these synthetic molecules. We have a solid clinical and preclinical foundation with our program for glaucoma. We have multiple human clinical trials that have already proven that THC has the ability to lower intraocular pressure. We're bringing forward a novel molecule that can now replicate that. And our preclinical models so far have demonstrated that our lead molecule SPI 100 is superior to the standard of care. We have strong intellectual property. All of these molecules that we're developing are novel chemical entities. We have composition of matter, and we're expanding the pipeline. So the lead program certainly is what we've been focusing on and speaking about, but we have a wider opportunity in ophthalmology and beyond. The company is well capitalized, so we just completed a funding. We're focusing on taking that funding through meaningful clinical inflection points. That means finishing phase one, top line data from our phase one, and final data readout by multiple kind of data points throughout next year, as well as the initiation of a phase two program in 2022. Okay, just moving along here. So I talked about the endocannabinoid system briefly. It's a very complex kind of signaling system which exists in all types of tissues. It plays a vital role. There are at least two well-known cannabinoid receptors, CB1 and CB2. That's what a lot of people have heard about. But there is also evidence that there's many more receptors involved in the ECS, and those receptors are kind of found in multiple structures or various structures in the eye. And those receptors have been shown to be involved in a broad set of different pathologies. So lowering pain, lowering pressure, minimizing pain, anti-inflammation, anti-fibrosis, as well as neuroprotective capabilities. So from an ophthalmology development perspective, we believe that CB1, CB2, PPAR gamma, GPR55 are very exciting, and they're validated targets for treating the disease. And these are the pathways that are demonstrating these types of applicability in the ophthalmology setting. So for us, just to narrow the focus here, glaucoma is what presents the largest unmet need. 80 million patients worldwide, 110 million. Sorry, the patients continue to kind of increase, estimated to be 110 million by 2026. Large market opportunity in terms of $7 billion addressable market, but 80% of that market so far has just been represented by these generic prostaglandins, and which is latanoprost, or beta blockers, which is timolol. And patients are desperately needing a new class of therapy in terms of this opportunity. So we believe that kind of the beachhead for Skye is entering into the glaucoma market. We can disrupt this area with a new class of therapy, and certainly expand into a broader ophthalmology pipeline. Okay, so yeah, this was just the market and the opportunity here. We're just going to give an overview of the, kind of what a glaucoma patient's dealing. So this is the pathophysiology. Normal eye has good pressure. There's good fluid in the eye, but when the drainage canal is blocked, the fluid just staying in the eye, so it has nowhere to go, and that's really increasing the pressure inside the eye. And that increase in pressure is damaging those blood vessels and optic nerve, and can have a crush-like injury. So that's what's basically leading to this progressive vision loss and blindness. So over time, there's less of vision possible for glaucoma patients. So basically, these ECS receptors, specifically the CB1 receptors, are found in a lot of different tissue in the eye. They're responsible for fluid production, as well as for the drainage. So there's basically several different kind of tissue structures in the eye that play a very vital role. What we're saying is that THC and the CB1 receptor are involved in lowering IOP activity, and this is likely because these ECS receptors are being activated that allow for the fluid production, and they're ensuring that appropriate flow from the posterior chamber of the eye to the anterior chamber of the eye, and they're being and the aqueous humor is being able to be filtered out through these different pathways, and that's what's basically the mechanism at play. So this is quite exciting science, and quite exciting that you can deliver THC in a very successful way to be able to lower intraocular pressure, and you're seeing that shift happen because of the unique receptors that are located in the eye. So here's the advantage. We have a proprietary molecule. When you do systemic administration of THC, you have several different challenges. You're not going to get the appropriate dose. You're not going to get it into the eye. And THC is lipophilic, so it's not really easily delivered topically to the eye. What we've done is made a proprietary drug. It's a prodrug, and that basically increases the solubility and the polarity of THC, allowing it to better penetrate the tissue. So once it's in the eye, it's converted to THC by the enzymes, and then basically it's binding to these different receptors that are located in the eye, and then you have the active component that happens. So we've done several different clinical studies showing this. In this slide, I'm just highlighting two different examples. One, in the figure one on the left-hand side is preclinical. Several preclinical studies. This is just an example of one where SBI 100 demonstrated a superior IOP lowering when you compare it to leading therapies in a single agent model. So this is done in rabbits, and it's a validated model for measuring reduction in intraocular pressure. And what you're seeing here by the gray line is that it's deeper and longer than any other single agent therapy. Then what we did is we combined it with the leading therapy. So it's a combination of SBI 100 with nutraceutical, and SBI 100 with latanoprost, as well as the comparison against the combination, which is rocklatan, which is Repressa and latanoprost together. And this is similar results where we show that deep blue line showing deeper and longer results when combined with Repressa. So this is again in rabbits. And what the results show is that it's equally as good as Repressa, and it's still better than latanoprost, and the combination is better and showing improved intraocular pressure. All right, so this is another way of looking at that unique activity in terms of the ECS working and modulating and changing the profile in the eye. So, in terms of we kind of mentioned that the main outflow here for the fluid in the eye is the trabecular meshwork, and this is an example of where in the trabecular meshwork we're measuring the flow of that fluid, and we're basically taking tissues that are healthy and measuring the flow, and then they add this TGF beta where they're able to demonstrate the kind of disease, and then they're measuring the flow again. And in both cases, you're demonstrating outflow in healthy and in the disease eye. And so the goal here is to deliver THC so it can really find the CB1 receptors and bind to the CB1 receptors to activate that whole process of the flow. And that's what this unique mechanism is relative to other drugs. Spencer, you still there?
Yes, I am.
Okay. Just want to do a time check. Just so
yeah, no, we're running. We're okay on time. We're running a few minutes behind, so we're running okay on time. You got about what? You got about like 8 minutes.
Okay, great.
Six to 8 minutes.
Awesome. So just to take it a step further here, this is when we bind CB1 receptors, you're seeing that reversal of fibrosis in the trabecular meshwork, and this is what this is really highlighting, is that we're directly able to show potentially that we're impacting the pathology of the disease. So this is just a slide highlighting where we're measuring RNA expression, and there's different markers for fibrosis. So these are those fibronectin, P42, etc. There are different markers for fibrosis, and we're basically demonstrating the structural change that's happening in the trabecular meshwork. So you can basically, on the bottom slide here with the green and red, you can actually visually see the difference when THC is reaching the trabecular meshwork. So, bottom line, SBI 100 is it's targeting the area of disease. Most drugs don't really target the area of disease. We're actually showing mechanistically how we're able to lower lower intraocular pressure by making sure that the pathway is actually being utilized for drainage. We're also being able to see that we're increasing the flow through the eye. So that whole slide that I showed earlier in terms of the activation along the different ways that where the fluid runs, as well as the decreasing fibrosis in the trabecular meshwork may improve the flow. So there's lots of good examples in terms of a unique mechanism here. There's also very good evidence of a powerful combination to add on current therapy. So we definitely feel this is a very important drug to consider when these patients are developing resistance to existing drugs. And then you have this interesting pathology that shows this neuroprotective capability, where you're actually seeing the kind of reconstruction or the change in the tissue structures in the eye. So quite a lot has been accomplished in the last little while. I'll talk about what we did in the last 12, 15 months in a second. But if you look at kind of where we're headed, there is a very clear path here in terms of how we're trying to demonstrate value and the opportunity to transform the treatment of the eye. So basically in the last quarter of this year, we're focusing on FDA pre-IND meeting, neuroprotection study results, completing our GLP tox studies. That's moving this program quickly into initiating the phase 1. We're on track to initiate that in early Q2 of 2022. We plan to complete that study relatively quickly, and then on the heels of that, start our phase 2. So that's really where the kind of major inflections are for the company, and we will have efficacy data coming out in 2022. The next slide here just outlines that in a different way in terms of the milestones. Upcoming, we have several different data points, and then we have also been very active in the research side of what we're doing with the THC molecule as well as our CBD-VHS molecule, and we've expanded into some other early stage activities. So what that is really focused on is expanding the ophthalmology pipeline, and it's really product-driven intellectual property. So all of the work that we're doing on the research side is really to demonstrate the value add that it would bring to the SPI 100 program. But at the same time, we've had a very efficient corporate growth and a very efficient use of capital. Just briefly on the cannabinoid pharmaceutical innovation program, we announced this this last month. So there's been a lot of activity in the cannabinoid space. You can look at various research that started in 1964 or early 60s and then has led to a number of different milestones. We are seeing, I think, an inflection forming here in terms of the pharmaceutical cannabinoid space and the application in a whole range of different therapeutic areas. We've basically decided to make a bet on this. We're doing several different collaborations with different universities that have expertise, and that's in the US as well as in Europe. Why all of that work? Well, it's been validated so far. GW Pharma and that acquisition in 2021 was a very strong validation that went beyond Epidiolex, in our opinion. Epidiolex was the first kind of plant-derived cannabinoid approved in the US, large amount of sales. They showed about 510 million sales in 2020. But clearly, that pipeline that GW developed was quite intriguing for Jazz, and that's what gave that multiple that they got in terms of the acquisition. So we're trying to recreate a similar model here with Skye. Our management team continues to form. I think we're very happy with the team that's come together in the last 12 months. They span multiple years of pharmaceutical experience, product development, and Kate is our most recent addition as our CFO. Similarly, our board continues to grow. We're continuing to be kind of strategic on the board side as well as the advisory side. Dr. Praveen Tile has been our most recent addition, and he brings a huge amount of experience on the ophthalmology side, as well as his leadership in drug development, working with Bausch and Lomb and Novartis as his kind of major areas. Advisors, will let everyone kind of plow through that when they get a chance, but just want to briefly highlight in terms of accomplishments. Really, we've strengthened our product development capability. We're very clear about our strategic plan around SPI 100. We've implemented a very capital efficient plan in terms of how the company has been executing while spending the capital. We definitely believe that we have a responsibility to the shareholders in terms of how that capital is used and how a value creation plan comes into play. What we've been able to demonstrate since I've come on as CEO is every quarter increasing the runway as well. So now we've raised about 21 million to date since August 2020, and we have a 15+ month cash runway. So we're in a very healthy position as a company.
Punit, we're up against the clock here. Really quickly, though, there's a question from the chat I wanted to ask, and it was asking you if you could expand on the studies from the University of Mississippi.
Yeah, so there's been we have with University of Mississippi, we have major licenses. So the one is involved with THC VHS, and the other is with CBD VHS. We're developing THC as I talked about today in glaucoma. There's been also several different collaborative research agreements that we have. And the data that I shared today on the single agent activity and the combination activity is the most recent data that's come out of that collaborative research agreement. So we continue to do additional research, but yeah, I'm not sure exactly if there's a direct question in there.
No, I was just asking you to expand on it. Punit Dhillon is the CEO of Skye Bioscience, ticker SKYE on the OTCQB QB, Punit, thank you so much for coming on today. Thanks for bearing with us early on with the slides, but a pleasure as always, and great job.
Hey, thanks so much, Spencer.
All right.
Awesome in terms of what you've accomplished at Benzinga. Keep it up.
Thank
And
you.
I'll
Thank you.
love coming on here anytime.
Thanks.